Do you know your blood type? Most people know it only because they once needed surgery or donated blood. But your blood type is more than a medical ID, it is a biological profile that influences your susceptibility to specific diseases in ways that most people have never been told. Today we are going through all 8 blood types: O positive, O negative, A positive, A negative, B positive, B negative, O positive, and AB negative, and for each one we are going to cover the one hidden disadvantage that science has documented. Not folklore. Not pseudoscience. Peer-reviewed research from institutions including Northwestern Medicine, Tufts University School of Medicine, the American Heart Association, and a 2021 study at Karolinska Institutet that analyzed the health records of over 5 million people. Blood type O positive. O positive is the most common blood type in the world, approximately 38% of people have it. And while it carries genuine cardiovascular advantages over other blood types, it is not without its hidden risk. Research published on WebMD and reviewed by UB Health confirmed that blood type O individuals have a slightly increased susceptibility to H. pylori infection, the bacteria responsible for peptic ulcers. The H antigen present on O-type red blood cells appears to facilitate H. pylori adhesion to the stomach lining. Additionally, one study found that women with low healthy egg counts were more likely to have type O blood than any other type, raising questions about ovarian reserve that researchers are still investigating. If you are O positive, monitor your digestive health and consider H. pylori testing if you have recurring stomach symptoms. Blood type O negative. O negative is the universal donor, the blood type that can be given to anyone in an emergency. That is its famous advantage. Its hidden disadvantage is the flip side of that same coin. O-negative patients can only receive blood from other O-negative donors. An O-negative represents just 7% of the population. In a medical emergency requiring transfusion, finding compatible blood for an O-negative patient can be significantly more challenging than for most other types. Additionally, Rh-negative women, including O-negative, face Rh incompatibility risk during pregnancy when carrying an Rh-positive baby. The body can produce antibodies that attack the baby's blood cells in subsequent pregnancies. This is fully preventable with Rh immunoglobulin treatment, but only if the mother knows she is Rh negative and informs her doctor. Blood type A positive. A positive is the second most common blood type, and it carries one of the most clinically significant hidden risks. Studies published by Northwestern Medicine and Tufts University School of Medicine confirm that type A blood is associated with higher risk of gastric cancer, largely because H. pylori infection, which promotes stomach inflammation and cellular changes, is more common in people with type A blood. Type A blood is also linked to higher pancreatic cancer risk, with a hazard ratio of 1.32 compared to type O according to research published in Links. Additionally, type A, B, and AB blood types carry higher rates of venous thromboembolism than type O due to higher levels of von Willebrand factor, a clotting protein. If you are positive, prioritize regular gastric screenings after age 45, test and treat H. pylori promptly, and stay on top of cardiovascular health monitoring. Blood type A negative. A negative carries the cancer susceptibility of A-type blood combined with the Rh-negative pregnancy consideration. But its most specific documented risk is early stroke. A study cited by Tufts University School of Medicine found that people with blood type A were slightly more likely to have a stroke before the age of 60 compared to type O. The mechanism involves higher levels of von Willebrand factor and factor VIII in non-O blood types, proteins that increase blood coagulation tendency, raising the risk of the arterial clots that cause ischemic stroke. If you are a negative, active blood pressure management before 60 is especially important. Rh-negative status requires medical attention during any pregnancy, and smoking, which dramatically amplifies clot and stroke risk, should be treated as particularly dangerous for this blood type. Blood type B positive. B positive has one of the most striking recent findings in blood type research. A 2024 review published in the journal BMC Medicine found that people with type B blood, both positive and negative, had a significantly elevated risk of developing type 2 diabetes compared to non-B blood types. The hazard ratio for B-positive blood is 1.21 compared to type O, and 1.35 compared to the universal donor O negative. This is one of the strongest recent causal findings linking blood type to metabolic disease. If you are B positive, annual blood sugar monitoring is especially important. Maintain a healthy weight actively, and get HbA1c tested regularly, starting earlier than general population guidelines suggest. Blood type B negative. B negative carries a double disadvantage. It shares the significantly elevated type 2 diabetes risk of all B-type blood, with a hazard ratio of 1.35 versus O negative in the MLINKS research database. And as an Rh negative blood type, it also carries the pregnancy Rh incompatibility risk that applies to all Rh negative women. B negative represents just 1.5% of the population, making it also relatively rare in blood donation supplies. If you are B negative, combine the metabolic monitoring of a B-type individual with the obstetric awareness of an Rh negative person. Annual metabolic screening and immediate disclosure of Rh negative status to any obstetric provider are both essential. Blood type AB positive. AB positive is often called the universal recipient because it can accept blood from all donors. But it carries what may be the most serious hidden health profile of all A types. Type of blood has been identified as carrying the highest risk of venous thromboembolism, dangerous blood clots in the deep veins and lungs, of all blood groups. According to the American Heart Association and confirmed by WebMD and Medanta, our blood also appears to have the highest heart attack risk of all blood types due to elevated clotting factor levels. A study cited by WebMD found that people with memory problems had type of blood more than any other, suggesting a possible link to cognitive vulnerability. If you are AB positive, annual cardiovascular screening, active monitoring of clotting markers, and complete avoidance of smoking are particularly urgent for this blood type. Blood type AB negative. AB negative is the rarest blood type in the world, less than 1% of the global population carries it. And it combines two significant vulnerabilities. First, it shares the highest VIT risk of a blood type, the same elevated clotting and heart disease risk profile as AB positive. Second, as the rarest Rh negative blood type, AB negative patients face the most critical challenge of all in emergency transfusion scenarios. The supply of compatible blood is extremely limited, which can create life-threatening delays. AB negative women also carry the Rh negative pregnancy risk. If you are AB negative, always carry blood type information in your emergency contact and medical ID. Cardiovascular risk management and immediate disclosure of Rh negative status in pregnancy are both non-negotiable priorities. Here is what I want you to take from this video. Your blood type is not your diagnosis. It is not your destiny. Every hidden disadvantage covered today has a corresponding preventive action, a screening, a lifestyle habit, a conversation with your doctor. The 2021 Karolinska Institutet study analyzed the health records of over 5 million people and found 49 diseases linked to ABO blood types. This science is real, documented, and clinically relevant. And yet 51% of Americans do not know their blood type, according to a 2023 Quest diagnostic survey. Find out yours. Tell your doctor. Get the screenings relevant to your type. And remember, lifestyle, not blood type, is the most powerful determinant of your long-term health. See you in the next video.
Yeah, we did it! Thanks for subscribing!
That's a brief look at Health Explained. Thanks for watching. Goodbye.